Mr. Doggett.
Thank you, Mr. Chairman. Thanks to our witnesses. There are those who believe that we're better off in America if many of the people who serve our meals, make up the bed at our hotel room, or educate our youth cannot access health insurance. I don't share that view. I'd rather like the people who are serving my meal to have gone to the doctor if they have the flu or maybe gotten a flu shot and have access to health care. I think the underlying reasoning of those who would repeal the Affordable Health Care Act is not unlike those who say they are helping minimum wage workers by keeping the minimum wage at a minimum and not raising it to a livable wage, as the President is seeking to do through an executive order for those who are federal contractors, in which the Congress should extend to all minimum wage workers. It is true that the Affordable Care Act has been blamed for just about everything but the polar vortex. And I hear this story about bus drivers in Indiana. I mean, that was something that was reported last June about an event that won't even occur until 2016. You have to wonder whether it really had anything to do with the Affordable Care Act. We had a little of that with at least one community college system in Texas, blaming the Affordable Care Act for what it would do with adjunct faculty. And they ended up having to retreat from that position because, in fact, in Texas, since 2003, adjunct faculty at our community colleges have been eligible for health coverage of the same type that is offered to full-time faculty and employees. Indeed, 3 years after the Affordable Care Act, last year, Governor Rick Perry signed a law that made even more adjunct faculty eligible for that health coverage. You have to think that if a state can't meet the low level Governor Perry sets, that it really has problems much bigger than adjunct faculty. At Austin Community College, at the Alamo colleges, we have many adjunct faculty members that are working fewer hours than 30. They're eligible to get coverage. The question is, who pays for it? At the adjunct faculty level, if you have a lawyer who is part-time teaching business law, they probably have coverage through their employer already. Unless the insurance is unaffordable, it exceeds 10%, 9.5%, I guess, of their income, there is not an obligation to provide coverage. There are many reasons why community colleges use adjunct faculty. Some of them are citizens in the community who are doing very well and enjoy teaching on a part-time basis. There are many others in some communities, as the Democratic staff of the Education and Workforce Committee reported in January, who are treated very poorly and paid very poorly and very much need the very kind of health insurance coverage that the Affordable Care Act offers. There are also many people in the private sector who are benefiting from the Affordable Health Care Act. I think of Gabe Farias, who's the executive director of the West Chamber of Commerce in San Antonio, Texas, a group of small businesses that are really encouraging job growth in that community. Mr. Farias was telling me that both he and his wife were able to get significantly better coverage at less because of the exchanges in the Affordable Health Care Act. I think of Ron Romero, who is in the technology industry, who talked about the advantages of avoiding job lock that were offered by the Affordable Care Act that encourage the expansion and innovation in small business. And it's to be remembered that this 30-hour rule did not come to us like manna from heaven. Like most of the problems with the Affordable Care Act, and there are many, it was the result of compromise in the legislative process. There were some who said, well, you know, we really should not ask employers to cover half-time workers. Let's go with 30 hours as a reasonable compromise. If we'd gone with 25, we'd be here today hearing about the 24-hour rule. If we'd gone with 35, we'd be here today hearing about the 34-hour rule. I think, Dr. Levy, you pointed out that if we'd used the 40-hour standard, what would we have, about 3 times as many people affected?
Yes, that's right. 3 to 5 times as many workers potentially at risk of having their hours cut.
So I think what we achieved is a reasonable balance. We need to be working to see that all Americans have access to a family doctor, to affordable health care, That's the direction in which we have moved. We have done so imperfectly. We've done so with a considerable amount of bungling in the rollout of the Affordable Health Care Act, but its objectives are genuine and the potential is great. We need to be working to achieve it instead of undermining it. I yield back.